bringing you the best of beauty. Today, we're going to be discussing Radiesse tissue filler in the male patient. In the female, we inject the zygomatic bone of the cheek, and we inject it on the top of the zygomatic bone, putting some material right here, which equals here, to give a nice high cheekbone and to give lift, to lift the mid-face with the nasolabial fold and the jawline. If we did that to a male, we would feminine a male and make him look very feminine. So we inject along the lower edge to give him a much more square area. Both males and females are injected in the mid-face underneath the zygomatic arch, and males, if they need it, after being injected along the lower aspect of the zygomatic arch, we frequently will inject along their jawline as well, giving them a square jawline and a more masculine look. Here we are with Jim. Jim is our male patient that we're going to be injecting Radiesse into his face to soften him by filling in his mid-cheek, opening up his eyes by injecting into his temples, and giving him a much more square jaw. Jim has recently had an excellent treatment of his lower face and his neck. Again, as I mentioned earlier, with the male face, we don't want to make them feminine. So we need to inject the male face very differently than we do the female face. So we want to feel for the zygomatic arch. And with men, we want to inject in the lower portion of it here. I don't want to give him a high cheekbone like we would a woman. We want a nice sweep here. With a male, we want a much more angular, square face. So we're going to start with injecting his cheekbone. We're going to inject his temple to give him a little bit more width and a stronger forehead. And then we'll inject in soft tissue here, and we'll see how much correction that gives us to whether or not we need to inject a little bit on the mandible, the jaw itself. So as I mentioned before, we don't want to inject at the high cheekbone here on a male because that's going to make them feminine. So we're going to find anatomically with our finger their zygomatic bone, and we're going to inject underneath their zygomatic bone, which then is going to give them a lateral pull this way. And then I'm going to come in and fill this little triangle in here. We've injected his temple. We've injected his lower zygomatic arch. We've actually cross-hatched his mid-face by injecting this way and this way. We haven't quite finished him yet. I am going to be injecting along his jaw, but I think that you can see already the transformation between one side, peaks and valleys, to the other side. How are you doing?
I'm great. This is awesome.
Great. So thank you for watching. My name is Lisa Topham. Please subscribe to my YouTube channel and visit me on Facebook.